Hi, I'm Dr. Gary Vela. I'm a board-certified plastic surgeon, and what we're going to do today is we're going to talk a little bit about tummy tucks. I'm going to talk a little bit about what they're about, what's involved in how we do them, what to expect from their outcome, and in the end, what's it like to have it done and who are the best candidates for it. Tummy tucks, otherwise known as abdominoplasties, are where we actually take the patient's midsection and contour it by removing fat and skin and shaping their waist to give them that flatter, smoother belly, one of those areas of the body that we really just want to be able to fit in the clothing nicely and look great in a swimsuit. So let me give you an example of what a tummy tuck is. So I'm gonna have you take a look at this. Here's a picture of a typical result before and after of a tummy tuck. When we see patients, whether they're men or women, they tend to have excess skin and fat around their midsection, producing rolls and bulges that we generally just don't like. Our belly buttons tend to be a little distorted. Sometimes they look like upside down smiley faces. Other times they look misshapen, or you can see here in various different shapes and forms that just don't look like a belly button. In addition, you'll see that there's bulges down below. When we do the tummy tucks and we're finished, what we end up with is a flatter belly, less fat, less skin, more contour to the waist, and a belly button that looks very natural. I'm going to tell you this, that when you perform this procedure, this result is what a patient will see as soon as 5 days after the procedure. They can literally go to the pool and put on a bikini or a swimsuit and nobody knows they've had the procedure done. The best thing about it is it keeps getting better. So every week afterwards, it looks better, smoother, trimmer, and the end results look nice. So what is a tummy tuck and how do we do it? Well, essentially, patients come in, we look at them, we decide if they're a good candidate. Now, what makes a good candidate for a tummy tuck? It's generally a person who understands what they're going to have done. They understand that we're going to make an incision down below the bikini line or a swimsuit line, that they're going to have that as a little bit of an evidence of something that's happened, but nobody sees it because it's hidden by the underwear or a swimsuit. They understand they're going to have a procedure that may last approximately 2 hours for the most part. It may involve a little bit of liposuction. Sometimes we do that to sort of contour the waist, and that we tighten loose muscles. Now, some of the questions I get is from patients is, do I have loose muscles and do I need anything done with those? Many women who've had pregnancies stretches out their stomach muscles and loosens them and they bulge out. So even though they have fat and skin that's sort of still sagging there, their stomach muscles are actually a little bit weaker. It happens to men too, because as men gain weight, they gain fat on the inside of their bellies pushing out. So when we're inside there doing the procedure, we tighten those muscles up, much like you would tighten up a corset or the shoelaces on your shoes, where you just tighten things up and the shoe becomes a little more snug, so the belly becomes more flat. The important point is this: we don't have to cut any of those muscles. So there's no discomfort associated with cutting any muscles at all. I'll tell you, there are some patients that don't need that at all, so we do make that decision independently with each patient. The other good candidates for these kind of cases are patients that have lost lots of weight. We see patients all the time that go through either self-directed weight loss and do a fantastic job of doing it, or there are bariatric patients. That means these are patients that have undergone surgical procedures designed to create weight loss. And they can lose anywhere from 50, 60, 80, 100, 200 or more pounds. And when that happens, the skin begins to sag as the fat starts to go away, and the skin just can't keep up. So the patients end up having loose, saggy skin that does not do anything but cause problems for the patient. So our job is to come in and remove that. So these are ideal candidates for patients. And of course, patients should be in good overall general medical health, and that's determined ahead of time, and we work either together with us as physicians or with other ancillary physicians such as their primary care provider, internal medicine doctors, to make sure that they're really, really up to speed as far as their health and ready for the procedure. Now, let me tell you this. What is involved when we do the procedure? Well, I'll tell you, it's a little bit more simpler than most people expect. It's very common that I hear stories about how some people think it takes a long time to recover, or there's a lot of discomfort associated with it. I think I'm going to clarify something, that over the last 15 plus years, I'm going to tell you thousands of cases that I never really see patients experience those levels of discomfort or recovery. The typical scenario is a patient will come in for a consult. We make the determination of this patient's a good candidate, and the patient says, this is what I want. They come in for a pre-op visit where we have photographs taken. We measure them for garments that they wear to help them during their healing process. And we go over all things that relate to the pre-op process and the post-op recovery process. Their appointment day of the procedure, they come in early enough, generally at least an hour ahead of time. We have board-certified anesthesiologists that evaluate the patients and make determinations for their anesthesia plan. The patients come to the procedure room, the operating room, and they go to sleep. What is 2 hours of time that passes seems like 2 seconds to the patient. And what we do is the exact thing I described. We take away extra skin and extra fat, we tighten muscles, we contour that belly, and the patient wakes up in the recovery room saying the very common statement, I felt like that was 2 seconds. Most importantly, when they wake up, they're not in pain. I think the important aspect of discomfort when it comes to procedures is managing the discomfort. And that's very important to us. We can have fantastic results, but if the patients are sick, maybe nauseated, or have higher levels of discomfort than expected, that contributes to a little bit less happiness with the procedure. So those aspects are just as important as the end result of the procedure. After a short while in recovery, the patients go home. There is no need for patients to spend the night in the hospital or have any type of specialty care unless there's very special circumstances, which are very few and far between, and I can honestly tell you I don't recall. So the patients go home and they have easy access to us by a telephone call if they need to talk to us about anything, or they can reach our nurses as well to have questions at any time during the day, 24 hours a day. Patients then recover very quickly, and I'm a big fan of one thing. I say all the time, I operated on your stomach, I didn't operate on your legs. So I want you up, moving around. So I like my patients to be up, walking that night, getting things to eat and drink, going to the bathroom, even going upstairs very slowly and carefully. Sometimes people need to have a little assistance to make sure they're steady on their feet, but I do want them up. I want my patients in the shower the next day, and I want them active. And there's nothing better than to see a patient 3 or 4 days after this procedure saying how easy the process was, how little discomfort they have, and they're in fact going out maybe even to dinner 5 days later. Most of the time, my patients go back to work within 1 week's time frame. There are certain circumstances where patients have very active, demanding jobs like police officers, firefighters, or people who do a lot of heavy lifting. In those cases, we do have to customize the recovery a little bit. Maybe we limit the amount of strenuous activity they have. But again, I'm a big fan for them being active. So if their job is tolerable and they're able to go there with some limitations, I want the patients to go back to work and resume their activities of daily living. They will recover faster that way every single time. In the end, when the patients come back for their visits, generally at 1 week, and then they come back a few weeks after that, and then honestly, we see these patients every few months for up to a year. And sometimes patients say, so I'm going to see you for 5 or 6 times up to a year. And they wonder why. That's because the procedure simply doesn't end by us performing it and getting that kind of result. The procedure ends a year or so down the road when all your scars have faded, when everything about this looks great, and the patient continues to realize that their results are for the long term. These are not results that disappear after a month or 2. They are something that are with you as the years go by. And we want to see that, and we want you to experience it. I'm going to leave you with this last statement. The most important aspect that we do here is we change your body, we change how you look. But the most important aspect of all that is we change how you feel. And I'm telling you, when you change this aspect of your body, you're going to feel different. And that's going to leave you with a lot of happiness. And ultimately, that's what makes us happy.